Everyone. Thank you for joining us today on our panel about sexual assault resources in Philadelphia. My name is Azucena Ugarte, and I am one of the co-chairs of Shared Safety. Shared Safety is a citywide collaboration made up of both city agencies and community-based organizations looking to improve services for people experiencing relational violence, that is, intimate partner violence, sexual violence, and trafficking. We host these webinars for health and human services professionals every other month to improve knowledge about these complicated topics. To learn more about Shared Safety and to access resources, including toolkits for providers, you can visit our webpage on phila.gov. Today's session is focused on the resources for survivors of sexual assault. This is a timely session because April is Sexual Assault Awareness Month. Our panelists today come from 4 leading organizations in Philadelphia that work with survivors of sexual assault of all ages. So we are very grateful for their time today. Before we begin, I want to acknowledge this can be a difficult and personal topic. Even if someone is attending this webinar as a professional, please take care of yourself during and after the session. Also, during questions, please be mindful of not sharing private or confidential information. If you have questions for our panelists, please use the Q&A box, the one that is on the black bar at the bottom of your screen. Feel free to drop any questions if there is as they come at any time, and we'll do our best to answer them during the panel. Okay, so we have our panelists here. Let's start with this. The first round of questions is going to be for our panelists to introduce themselves, talk briefly about their role, and a little bit about their background. I'm going to start with Lakeisha Anthony.
Good afternoon, everyone. My name is Lakeisha Anthony. I am the Acting Executive Director of WAR Philadelphia Center Against Sexual Violence. I have been with WAR for almost a decade now. I started my career in the sexual violence field as a prevention educator, and then I moved into an advocacy coordinator and a senior manager of advocacy, and now I serve as the acting executive director of this phenomenal place called WAR. I am truly honored to be here today, and I am excited to have this conversation, and I'll pass it to the next person.
Thank you, Lakeisha. We're going to go with Nuria.
Good afternoon, everyone. My name is Nuria Orsino. I am the current Director of Family Services at the Philadelphia Children's Alliance. We are a child advocacy center that serves all of Philadelphia County. I have been at the center for 11 years now. I just celebrated my 11th year there. I started my career in another nonprofit doing prevention work. I've did foster care work, adoption work. I've done certification of foster homes. So over 20 years of working with families and children in different capacities. And I too am honored to be here this afternoon with you all. Thank you.
Thank you. Now, Shakora.
Hello, everybody. My name is Shakora, and I am the program coordinator with Philadelphia Sexual Assault Response Center, also known as PSARC. I am also a nurse and a therapist, so my work really has an intersection of medical care, trauma, and healing. I've been in the healthcare field for roughly 15 years now, and for the last several years, my main focus have been supporting survivors of sexual assault violence. I help coordinate care, coordinate community outreach across Philadelphia County, working with different universities, churches, and schools at all grade levels, just to increase the awareness of sexual assault violence and the resources that are available to them in Philadelphia County, of course. I also support our nurses, which are SANE nurses, sexual assault nurse examiners, and work closely with our clinical director, Shanita.
Thank you. Shanita.
Good afternoon. I apologize that my camera is not working. My name is Shanita Good, and I have the privilege of serving as the clinical director at PSARC. I have a very unique interdisciplinary background That includes a master's degree in forensic medicine and bachelor's degrees in both nursing and criminal justice. So with my professional experience being in law enforcement as well as in emergency medicine. So I have a unique approach that is survivor-centered, a lot of collaboratory work, and trauma-informed care.
Thank you, Shanita. And last but not least, Brandy, long-term member of Share Safety.
Good afternoon. Thanks for having me on this panel. My name is Brandy Stewart, and I use she, her pronouns. I am a licensed psychologist, and I am the Deputy Executive Director at Joseph J. Peters Institute, known as JJPI. I have been at JJPI since 2014, first as the Director of the Forensics Programs, then as Clinical Director over all the programs, and then the last 5 years I've acted as the Deputy ED, overseeing the main programs and several grant-funded sites as well. I have worked in the field of trauma, both with survivors and of individuals engaging in sexual and relational violence for the past 25 years. I am a governor-appointed member of the Sexual Offender Assessment Board for the Commonwealth of Pennsylvania, a member of the Association for the Treatment and Prevention of Sexual Abusers, and I have maintained a small private practice for the past 20 years, and that really all makes me sound pretty old.
Thank you, Brandy. As everybody can see, we have a very impressive panel today. So we are very, very thankful to the panelists that took the time today to come. So let's start with some of the questions. We know that somebody who experienced sexual assault may reach out for services right after the assault or years later, sometimes several years later. So talking about services right after sexual assault happened, when we're talking about medical services, forensic medical services, Shokora and Shanita, could you tell us how does that look like? What is the purpose of a forensic medical examination? And I know you work with 16-year-old and older, so with your population, and then Nuria, we would ask the same question when it's about children. But let's start with the PSARC services.
So for the past 15 years, PSARC has provided comprehensive forensic and medical services, as you stated, to survivors who are 16 years of age and older. We operate 24 hours a day, 7 days a week, and we follow the Pennsylvania guidelines for evidence collection for assaults that occur, which will be in the last 120 hours or 5 days. Our exams are conducted by specially trained registered nurses and advanced practice nurses who are experts in forensic examination collection and trauma-informed care. Each exam is different because it's survivors guided and what they tell the state nurse and what they disclose about the history of the assault. So we prioritize like autonomy at all times and just ensure that they know that they're in control over the care that they receive at PSARC.
Thank you. Could you tell us, or Shokora, where the examination happens, how long it might take? Does it mean that there has to be a crime report, or it could be separate? A little bit about that.
Sure. So an exam, it takes as long as the survivor takes, far as receiving the care. It varies. Again, because Shanita said it's autonomic, it usually ranges from an hour up until 2 to 3 hours, depending on photography, depending on the needs of the patient themselves. We are located at 300 East Hunting Park, right in the Shared Safety Committee building, right with SVU. So you would just walk into SVU. You do not have to make a police report in order to be seen if you are 18 years and older. However, if you are under the age of 18, you will have to make a police report. This service is completely free to all of our survivors, as well as the prophylactic medication that the individuals receive, be it for STI, HIV, or emergency contraception as far as prevention of pregnancy.
Thank you for that information. Nuria, PCA, the Philadelphia Children Alliance, provide services for children. How the forensic examination looks different in the case of children? What is the relationship with the parents there or the caregivers?
Yes, absolutely. So, for our juvenile survivors, if it is an acute case, so anything that is being reported within the 72 hours that would have happened, our youth 16 and older are being seen at the PSARC as just explained. And then our kids under 16 are then going to either St. Christopher's Hospital for Children or the Children's Hospital of Philadelphia through their emergency rooms for their kits and for those examinations. Now, the majority of the children coming to the center are delayed disclosures. So we are beyond the 72-hour time period. And so we are still recommending what is called a forensic medical exam for those children. Those exams are still completed by, we have an unprecedented partnership with both hospitals. So we do have a children's collaborative clinic right on site at 300 East Hunting Park, right where PCA is located as well. And so our clinic is open 4 days a week, 2 days staffed by each of the 2 different hospitals. And so ideally, children are able to come in and get their exams the day of their interview. And so the forensic exam really focuses on the child's overall health and making sure that their bodies are not giving any sign of trauma having occurred, but that their bodies are okay. Again, it's not focused on evidence collection, but it's still presented and recommended as part of the investigation. It is an external, examination of the child. It does include an examination of the child's genitalia and documentation, photo documentation. But there is no swabbing. There is no internal exam with this forensic exam that children go through. Less than 10% of children's exams show findings, but again, it is still recommended, and it is very important for kids' healing processes to still have access to the medical exam, which is offered on all of the cases.
Thank you very much for that information. So my understanding then is even if the 72 hours pass, in the case of children, let's bring them for that examination, right?
Absolutely, absolutely, because there may not be any finding on the physical exam, but there may be a positive screening on any blood work or urinalysis that indicates some sort of STI, which is a lot of the ways that kids' disclosure or investigation may initially commence or begin, is that they tested positive for something, even though they're not verbalizing or a disclosure of some sort. So again, even though it's focused on the overall safety and assessment of the child, so it's still recommended for them to participate in it.
Thank you. So survivors come, you provide these trauma-informed services. It's still a very difficult time for survivors. There's a lot happening, even with all the support that you provide from the medical piece and the clinical piece. So there are services in the city that we have for advocates to support that survivor with different steps of the process. Lakeisha, could you please tell us about the work of WAR's advocates, the work they do either with PSARC or at court, or how they support survivors? Oh, you're muted.
Sorry.
Oh,
I'll start with the advocates that are at PSARC, since we're talking about PSARC already. The advocates provide medical and law enforcement advocacy for survivors that are receiving a rape kit or a forensic exam, or also making a police report. They provide resources, sometimes referrals as well for therapy and other resources that they might need post the assault. So some of those resources that we help to support people with is VCAP, which is Victim Compensation Assistance Program, housing and legal resources. They also provide weekly check-in calls post the exam. So if you get an exam at PSARC, someone from our office will call you. We can support the individual through the whole process at PSARC or partial. It's pretty much up to the survivor's discretion of what they would like to utilize us for. Usually we walk the client through what the process will look like, what that entails, which includes the initial interview with the nurse, the exam within the exam room, and if they would like for us to be present in the exam room with them. And then we also help to discharge them. And if they would like to report, we also do a warm handoff to SVU and explain the process of that as well. The partial process is them choosing whichever process they would like for us to be involved in. So we can go from start to finish, or we can do any parts of those processes in which I mentioned before. Would you like me to go into court advocacy as well?
Yes, sure. Yeah.
Okay. So court advocacy, what we do is we do accompany services for individuals who are testifying for trials or preliminary hearings. We talk to survivors before they actually go into the courtroom, and we give them a safe person that they can look at, a safe person that they can operate with in that process. Specifically a focal point if an event that they are testifying, we are in the courtroom, we become that focal point in the courtroom for individuals that want to make sure that they're not looking at their perpetrator, but want to look at a warm, familiar face in that process. We give them access to resources, and we also obtain a list from both family and from both courtrooms to ensure that we are seeing and supporting all of the sexual assault cases that are available there.
Thank you. And the court accompaniment and the advocacy, that does happen only with adults or also in cases
Oh,
are
it
you
actually
also
happens with
advocating?
both adults and children. And one particular fact, if an event that there's a child 18 and under that is testifying in that courtroom, usually the adult that that child disclosed to cannot be in that courtroom with them. So therefore, that's where we come in handy. We are the individuals that are supporting, helping that parent and that child feel safe, and also secure that someone is supporting their child in that moment where they are away from them, and also communicating them to what the process may be and ensuring that they know who all the individuals and all the parties are in the courtroom and in that process.
Thank you. So we've talked about the medical care right after the sexual assault. We talk about the advocacy support through different stages. It could be the criminal stage or the medical piece or the counseling. And that's where we're going to go now. Talk about counseling and therapy support for survivors. So, Brandy, JJPI provides therapeutic services for survivors of sexual assault. Could you tell us what ages do you provide services to, what age range, and how do your therapists approach that work? What type of training they have, what type of work they do with survivors?
Yeah, sure. Am I unmuted? Yes. Okay. We treat as young as, well, we do early infant. So we go as low as 3 in one of our grant funded programs through the complete adulthood. So we have elderly individuals as well as, like I said, 2 and 3 year olds through our childhood and early infant services as well. I think there are like 4. When I was looking at this question, I really liked it because there are 4 components I think that are extremely important when we're engaging sexual assault survivors in our approach with therapy. And I think, we really have to be, and our therapists are compassionate, intentional, patient, and really show humility. JJPI's therapist approach always prioritizes safety, and that includes both emotional and physical safety, and constantly being mindful of everything from their tone of voice to their body language to the pace of the session. Understanding that trust obviously doesn't come easily, and we do not rush disclosure. I think a very strong myth of trauma therapy is that we'll overwhelm them in therapy with re-traumatizing them, and that's actually the exact opposite of what therapy does. It's a very slow pace. We're not simply treating symptoms, but the role is to really, the JJPI trauma therapist, create a space that's safe, it's full of dignity, and consistently trying to restore control for the survivor. As we know, that sexual assault involves a profound loss of power. So the therapists are very intentional about offering choice in all aspects of the therapy. And that includes setting the pace of the therapy, deciding what to share, and establishing those boundaries. At the core of the approach is always a trauma-informed framework. So recognizing that trauma can shape a person's thoughts, behaviors, relationships, sense of self. It's that sanctuary question of what happened to you, which centers on the survivor's experience without any blame or without any judgment. At JJPI, we offer a number of evidence-based approaches that are considered, if appropriate, for a participant. And these include trauma-focused CBT for our kids, our children. All the survivor services clinicians are trained in TFCBT. We have about 60 clinical staff, which include our supervisors, our evaluators, and our clinicians at our survivor services. If a child is presenting with some problematic sexual behavior, we'll refer them to a trauma-focused CBT trained therapist that's trained with the PSB component, the problematic sexual behavior. We also currently have a team of 18 therapists in our prolonged exposure team. For those of you who may not be familiar with PE or prolonged exposure, that's an exposure-based trauma treatment that gradually uses imaginal and in vivo exposure. We have several therapists who are trained in eye movement desensitization and reprocessing. Briefly, this is just therapy that works by guiding clients to focus on traumatic memories while simultaneously engaging in bilateral stimulation. So that might be eye movements, might be hand tapping, or some auditory cues. And this helps the emotional intensity of these memories. And then we have both an adolescent and adult DBT teams as well. And we focus on mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. We often use DBT to assist participants with learning regulation skills prior to the trauma processing. JJPI has trained evaluators, which are all supervised by licensed psychologists who make the evidence-based practice recommendations at the onset of treatment. However, it's really important to talk about our comprehensive and ongoing assessment, and that's essential throughout the duration of treatment. So EBPs could be recommended at any stage. I also think it's really important to mention that, all of we have master's level clinicians or doctoral level, and all of our clinicians at JJPI receive weekly group consultation. Many of them have multiple consultations because they're part of EBP teams and they have separate consultations for those. And all of our full-time clinicians receive an hour of individual supervision by a licensed mental health professional weekly. We also have a semester of training didactics each year that provides specialized training and education in trauma-related topics such as human or sex trafficking, EBPs, skills for trauma, supportive therapy, many other topics. And we usually have outside experts come to present those. And then just to follow up a little bit on the specifically addressing what survivors should expect. Survivors at JJPI who are focused on past sexual assault, they can expect a process that's paced, collaborative, and definitely grounded in safety. The goal is not to force disclosure or relive trauma, but to support them in healing so they can restore a sense of control and stability. Everyone has a choice and consent is ongoing. JJPI therapists will check in often, offer options, respect the autonomy throughout the process. Therapists also will understand their responses. So when anxiety or hypervigilance or avoidance arise, these are normalized. These aren't signs of pathology, but we look at those as trauma responses. Every survivor will learn skills and grounding techniques so that they can feel safe. And only when they feel safe and they feel ready will any processing of the trauma begin. And then there's always a strength-based approach. So we're highlighting that survivor's resilience and helping them reconnect to their identity just beyond the sexual trauma.
Thank you, Brandy, for that comprehensive presentation about the services, the therapeutical services at JJPI. So Nuria, PCA also provide therapeutical services for children exposed to sexual assault, or if you cannot provide it in-house, you refer also to a network of providers. So if you can tell us a little bit about your services, and then how would you identify what other providers are in the community that can provide this support?
Yeah, absolutely. So I'll start with our in-house program. We do have a small clinical program in-house. All of our clinicians are cross-trained in TFCBT, as well as other modalities that were spoken of by Brandy as well. An additional one, we do have a YPSB clinician as well. So youth with problematic sexualized behaviors. So children, whether they're disclosing abuse or not, may develop some sexualized behaviors that, have to be addressed. And so we do have a clinician who works with that population, both over and under the age of 10. So initially when that particular service began, we were working more so with children under 10 because they cannot be held criminally liable for their actions. But we have since expanded those services to children above the age of 10 through 13, 14 years old, once we have acknowledgement that they are not going to be pursued for an arrest on a criminal matter that they may have been involved in. And so we do have a trained clinician who works with that population. We also do assessments. So we have a child victim of human trafficking assessor and clinician as well. So children are victims of trafficking or exploitation. We are seeing a rise on hands-off offenses, so images of children that are being taken and distributed, whether the child is aware or not aware. And so we have an assessor who's able to work with children who are displaying risk factors, right? Chronic runaways, children who have material, that are unexplained. Where are you getting this from? Images of children who are sharing, meeting people online. And so she's able to meet with these youth, meet with their caregivers, do more thorough assessments to see if there is confirmed trafficking or exploitation that may be happening, and then make specific recommendations for that particular youth. And if there is concern of exploitation or trafficking happening, then we're able to keep that child in-house and connect them with our CVHT clinician as well. And then in terms of our external referrals, so we do have in JJPI and WAR are two of our 22 partners. So we have official linkage agreements, partnerships with 22 different mental health providers across the city of Philadelphia that we have really worked hard for, for many, many years to sustain and also help build capacity for our children. We know that the sooner children and any survivor engages in intervention, the better and the faster their healing process is going to go, right? And so we have very streamlined referral processes established with our partners. We're able to share information. The interview that the child has, there is a written report that accompanies that video recording. Because of our official partnerships with our mental health providers, we are able to share those reports with them so that they know what already has been disclosed, what already has been investigated, what the child has stated already. In the event that something comes up in therapy, they know whether or not they have to report something new. And so we are able to really get our kiddos engaged in treatment very relatively quickly because of these partnerships. Our partners try to prioritize our referrals. And so we try, in terms of your question of how do we choose where we're going to refer the children, right? So we start with where the family lives. We know access is going to be important. So trying to remove the obstacle of any transportation needs that may be necessary. So connecting them with a provider in their own community. If there are nuances, so insurance needs or language needs, then we need to go outside of their community. Then those are things that then we're deciding, okay, they have to go to JJPI because this factor is coming up, or we can keep them in-house because they're uninsured. Insurance is a huge barrier right now. Many kids are coming up uninsured or privately insured, which a lot of providers do not accept private insurance, including CHIP. Folks may not be aware that CHIP, even though it's subsidized, is considered to be private insurance. And so our grant supported partners and our in-house program really helps to try to fill those gaps for these specific needs that families may be experiencing.
Thank you. And no, I did not know that. So I think this is very important for our communities to know. So Lakeisha, WAR also provides therapy services. Could you tell us about the services? Muted.
So sorry. We provide free trauma-informed therapy services to people of all ages, starting at age 3. We also do a different array of different modalities as well, the same as Brandy talked about, trauma-informed cognitive behavior therapy, prolonged exposure, movement desensitization, and EMDR. We also offer all of those as well. And we have done trauma-informed yoga and other practices like art and narrative therapy as well. Currently, our services are limited at the moment, but we are in the process of restoring some of those services. But the services in which we're providing now is we are currently seeing children, children clients from previous caseloads. We are also offering SAGE counseling services for survivors from our wait list.
Thank you. And before I go to the next question, because of the mentioning of, could we go and just let me know which programs are free without insurance, which programs accept insurance, both CBH and private insurance, just so people know.
Yeah. So all of WAR service, I'll start. All of WAR services are free.
All of PCA services are free as well, not just our clinical services, all of our services across all departments.
Brandy?
Yeah, JJPI is a Medicaid provider. So we do have other county. We are in Delaware, Chester County. We have also through Medicaid, but we're 98% Medicaid. We do not take private insurance.
Great, thank you. So we're starting to wrap up and then have opportunity for questions. So if a survivor is not sure about what to do next, or is having doubt about reaching out for services, what do you think the survivor should know about your services before they reach out, if they're thinking about it? And I'm going to start with Shokora and Shanita. If this is an assault that just happened and somebody is not sure if they should have a medical forensic examination, let's think if an adult, they don't know what the purpose would it be helpful or not, where do I go, what you could tell them, not to convince them, but just so they get more information about what to do.
I would emphasize and encourage anyone at any time to contact PSARC without any hesitation or in their moments of uncertainty. Like, these survivors are experiencing the most difficult moment of their lives. So it's hard to make a decision at that moment. So I would encourage and educate survivors on that, you can report anonymously and have your chance to have that evidence collected and held until you're in a better space and can make a more informed decision. But I would also encourage anybody that is not like an acute case just to call, because although PSARC may not have the resources or services that you can benefit from at that time, we have collaborations with other agencies that can help. So I would definitely encourage, even if it's a second of a thought, like to call and reach out for clarification. Shakura.
I would have to piggyback off of what Shanita said, just calling in because we have plenty of resources for all of our survivors. On top of, even if it's not for that evidence collection, like Shanita said, it's for that medical care. It's a lot of times that we don't see the underlining. So coming in just to make sure you're not, leaving with anything more than all of the trauma that you already have regarding the assault itself. I also would like to just let the survivors know that we meet you where you are. You do not have to know all of the answers. You do not have to know where you are going. We will assist you. We will guide you. We are there to hold your hand and walk you through every step. We're very patient. We're kind. We're just there.
Thank you. I think it's very important what you're saying. You still can call, even if you ended up not going to get the services. Call, you can listen to their concerns, you can explain everything. And if they decide not to get the medical examination, there are other resources that are available. So it's a good way to connect. Yeah, thank you. Nuria, it could be different for children, right? So if a family member suspect that something has happened to a child, or they have some behaviors that are problematic and they suspect something happened, even if they want the best for that child, they also may be very apprehensive about what happened if I reach out for help. Is there a report of child abuse going to happen? What is going to be the impact in my family? So if you can talk a little bit about that, and I know we're all mandatory reporters of child abuse, so there is that. But even with that, what the family should know, caregivers should know.
Yeah, absolutely. And we see that every day, fears of families and caregivers. Is my child going to be removed from my care because of this? Right. And those are real fears. And those are conversations that we have to have with caregivers. But assisting them in understanding, as you said, right, that this is for the benefits of their child, and that engaging in a formal professional investigation to come to an outcome of what may be going on is for the benefit, first and foremost, of their child. I would want caregivers to know that at the center, we are family focused, we are child centered, and that their child is going to be safe. We are in no way going to re-traumatize their child. Children have autonomy over whether they want to be interviewed or not. And we have many children who will not separate from their parent, and we will not force them to engage in an interview. Same with the medical exam. Doctors are not going to force that child to have an exam, but that access to resources, not just for the child, but for the parent as well, they can get that at the center. Many of our caregivers are survivors of childhood sex abuse, and we see that daily in this work. And so they too have unresolved trauma, and having their child now possibly be a victim is all re-triggering for them. And so that the parent can also access services that they may have never had access to for whatever reason, right? Whether they disclosed or not, because many adults are walking around with undisclosed trauma of their childhood. And also for them to know that we wrap our arms around the entire family. They're becoming connected to the center because of one or multiple children of theirs that are the subject children in investigations. But if they want therapy for siblings who are being impacted in some way by this process, that we can connect them to services as well. If they want other children to have access to a safety medical exam because the offender had access to that child, whether or not an active investigation is involving that particular child, we can give them access to that as well. So just so that they know that they don't have to walk alone, right? Sex abuse, sexual violence at any stage is very isolating, but especially in child sex abuse, there are so many myths, right? That there are so many people who believe that people don't abuse children in a sexual way, and the reality of that is so far removed that an active investigation that a family is involved in is naturally going to isolate them. Family members are going to take sides. People are going to believe and not believe, and that we are here to help support them through this process that is naturally, unfortunately, going to isolate them in some way.
Thank you. I think that's very useful approach for families to think through this. Brandy, similar question. If somebody thinking, well, this happened to me several years ago, I'm thinking that I'm finally ready to go to therapy, but I've heard that they use an evidence-based thing that maybe means that I have to commit to 20 sessions, that I have to be exactly every 7 days. Anything that you can share around that?
Yeah, I think first off is just recognizing that the hesitancy is very normal for therapy. It makes sense. And to let them know that therapy can start where they are. They are in control of the process, whether that be 8 sessions or 2 years of sessions. They won't be forced to share details. They won't be forced to revisit memories or go any faster than they're ready for. Again, I think quite a myth of therapy that that's how it works, and that's definitely exactly how opposite it works. And that they will be met with respect and belief and non-judgment. And I think what Nuria said as well, just that they don't have to carry this alone. We're here to support them, whether it be your child or whether it be you as an adult. And that, again, that they lead the process. They are in control. They have the autonomy.
Thank you, Brandy. Lakeisha, similar.
Yes.
Somebody thinking about calling the wars hotline, but they are not sure when they call what is going to happen. Are they going to ask exactly our screening questions? Tell us a little bit.
Yeah, so we do have a 24-hour hotline that is housed by crisis counselors that are available to speak to you at any time. We understand that sexual assault is carried throughout life for many individuals. So therefore, if it's not an immediate sexual assault that just happened and you're not in crisis, but yet you want to call because you saw something on the news and you're feeling a little triggered by that. You can contact us at any point in your process, even if you just have questions around what the process looks like. We have advocates that are on the line that will walk you through whatever you may need, whether it's immediate crisis care, whether it is finding resources and support that are not even with us. So, for example, if you needed housing support or something like that, we could direct you to a place that you actually could obtain housing support or other areas of support that you might need. We also do offer care for significant others. So that's a unique thing where if an event that someone you know, love, and care about has experienced sexual violence and you are having a hard time with that as well, then we also offer services for you as well. But anything you may need, you can call our hotline. We're there to help you navigate what the processes look like, what they could feel like. And if an event that you need someone to walk you through that, we are that person. We connect with all of the individuals that are here, as well as an array of other community partners that we connect with daily that can offer you modes of support in a different way that we might not be able to. And even though we do not have our counseling open to the public right now, our hotline is still available and we are still doing crisis counseling every single day. Individuals are calling us, whether that something happened 25 years ago or if something happened last night or even today, they can call our hotline for support.
Thank you very much. And thank you so much once again for coming here and answer all these questions. We are opening it now for the audience. There are a couple of questions. I'm going to start with the first question that came. That says, are you aware or can you give more information about the sexual assault kit tracking system PA will be implementing? This is just like new legislation that has been approved I guess even a few months ago. But I'm not sure, Shanita or Shakora, if you have information about how it's going to be implemented here in Philadelphia, or Lakeisha, or if this is actually a question for the police department forensic lab. Anyone who has any information, please feel free to answer.
So it is in this testing phase right now. Um, it's a tracking system that is live so that survivors can also see where their kit is along the process. It starts with the medical providers and then that's handed over to the law enforcement, but it's a live tracking system that they can follow to see where they're at.
Yeah. I'll, I'll chime in as well, because we were actually a part of implementation of that particular system. It allows for survivors to be able to track the process of their rape kit. Many survivors have complained about not being able to know what happened after the evidence was collected. And we know how a forensic exam is actually a part of that individual. You've taken pieces of that individual and it's shipped off and to in a sense into the abyss. So many people who are survivors are looking, okay, once that is done, what happens next? Where is it? And they're
Like show we.
calling around trying to get access. We track all of our
Okay.
packages, we track our food. So sorry.
Yeah.
Okay. So I was saying that we live in a society where, can you hear me now? You hear me now?
Yes.
Okay. I was saying that we live in a society where we can track almost anything. We track our packages, we track our food, and many survivors were voicing the idea that they wanted to be able to know where their forensic exam ends up and where it may be in the process. It does not provide you with results, but it provides you that tracking of where it may be in the process, whether it has left the exam facility and moved to the next space or the next space. And that's what that tracking system is for and why it was implemented. Yeah.
Does anybody know? So it seems that it's being piloted right now, so it's not live yet. Is that right?
No, it's not live yet. The practice just started Monday.
Okay, great.
The testing phase, like the physical, like testing phase just started this past
Okay, the
Monday.
testing. It's not pilot, it's testing phase. Okay,
Mhm.
thank you. Thank you, Shanita.
And I'll also add that it is statewide. So it's not just limited to a particular area or say Philadelphia. And the reason for that is because you might be in Erie, PA, but you live in Philadelphia and your assault happened in Erie, but you want to know how to track that process.
Okay. You lagged a little bit, so it's a statewide system. So it doesn't matter where county you live or where county the sexual assault happened, you will be able to track.
Yes, absolutely.
Great. Thanks. We have another question. It's a very practical question. What is the waiting list? Do you have a wait list for your services? How long is the wait list? And this is specifically for JJPI, WAR, and PCA. And I guess I would add also, if there is a wait list, do you have alternative for some crisis situations? How do you work around that? Nuria, do you want to go first?
Sure. So our wait list specifically for our clinical services, right now we actually don't have a wait list. So we have worked really hard. A lot of transition happened in the last several months, but we have a director of our clinical services who has worked really hard with our clinicians. So we do not currently have a wait list, but I do want to clarify that families and children connected to the center have to be referred, whether or not the child is going to be interviewed, they have to be referred by an investigator. So whether that's DHS or law enforcement, the family has to be referred to us. We get many, many calls of parents calling, even if they had a case several years ago. So long as they were referred to us at any point in time, we can engage with that family. If they are not in our system, having been officially referred, but the family explains, we made a police report, we'll follow up and we'll get the referral from our detectives and law enforcement over at SVU or even DHS, but we do need the official external referral, primarily from the investigator. We do get some referrals from the DA's office directly as well. And then if it's trafficking or exploitation, the Salvation Army refers for clinical services externally as well.
Okay, thank you. Thank you for that clarification. So when you say referred by investigator, that means either police department or DHS, our Child Protective Services.
Correct. Yes.
Okay. Okay. Thank you. Brandy, for your services, is there a wait list? How JJPI manages the wait list? Brandy, I think we lost you for a second.
Yes, I'm sorry. I think my internet's unstable. I'm guessing you're asking me the question, right?
Yeah. So what is your wait
Yes.
list? How do you manage that wait list?
So we currently do have a wait list. JJPI's wait list really wax and wanes. We didn't have a wait list several months ago, and then we do sometimes, we schedule like 60 evaluations a week, sometimes. So we're usually it's waxing and waning. So we do have one right now. We are actively hiring. We currently have 19 full-time clinicians at Survivor Services and multiple fee-for-service. I know we've just hired 3 new people. So we're actively hiring. We also do a same day. We are constantly trying to figure out how to reduce this with the amount of clients. We do have same day assignments that are being done too, because a lot of people on the wait list only have specific times they can be seen. So it's really helpful if people can give more of a range. Obviously, if it's kids, that it's after school hours, which we do hire specifically those clinicians as well. So we're constantly working on it. That is one of the big thorns especially for us administrators, that we want that down. So currently we do have a wait list, but we're hiring, so we're hoping that it's going to go down tremendously within the next month.
Thank you, Brandy. And Lakeisha, we know they're having issues with work capacity. So do you have a wait list? How are you managing that?
So we currently do have a wait list. Well, did not have a wait list. And unfortunately, that wait list has grown to. Can you all hear me now?
Yes, now, yes.
Can you hear me? Okay. So as I was saying, like Brandy, we did not have a wait list a few months ago, but unfortunately we do now have a wait list. And that wait list is internal. It's not an external wait list anymore. We are in the process of trying to clear our internal wait list through SAGE counseling, and also through regular counseling. And our SAGE counseling is a shorter term program, which is 3 months where they're engaged in counseling. And then they can actually be off to a therapist or a counselor beyond that for a long-term process. So we have not opened it up to the general public as of yet. We're working to clear our internal wait list, and then after that, we will begin to start to open up.
Thank you.
And we don't really have a wait list for our children right now. For our children, we're working through that list, and we are actively seeing child clients.
Okay. So you open for referrals for child clients?
We are open to referrals for child clients, but limited.
Okay. Okay. Thank you. So there
And
was
most of our partners are already referring those children clients.
Okay, great. So there was a question that came from the registration. So I'm just gonna read it and you can answer. Are there resources for adults who are survivors of prolonged child sexual assault? And I'm gonna venture and say yes. And those services, if I got it correctly, could be JJPI, right? Or WAR.
Absolutely.
Great, awesome. Not PCA, because you work with the children, unless it's a parent of a child.
So internally for clinical services, over the age of 18, we do interview if there is a disability of some sort over the age of 18. And so there may be situations over the age of 18 that we are working internally, clinically with someone, but that decision would be made case by case. I do want to say they're not present here on the panel, but there are other mental health facilities that also work with both child and adult adults in some capacity. And so that there are resources for adult survivors beyond this panel represented here today as well. And if anyone needed a resource for an adult client that they're working with, you could reach out to me and I can give you a resource if needed. You're muted, Azucena.
Almost the last 2 minutes. Yeah. I was saying this is a good segue to wrap up this panel. Oh, I'm sorry. There's one more question. Is there an updated link for the interest in the war advocacy program? I guess there's a link in the website that is not working.
Oh,
If
it's
somebody's
not
interested,
working.
yeah,
Okay, if someone is actually interested, what they can do is email me at Lakeisha, LAQUISHA, @war.org.
great. And what I wanted to say is thank you so much for coming and sharing this information. This is very important information for our community. Unfortunately, it's information that is needed a lot, as we have discussed today. We would follow up after this panel with an email to everybody who registered with the resources that have been mentioned during the panel. So Nuria, if you have a list of programs that provide also services, we would include that in our email. So those are some of the resources that were discussed today, but in the email, we would send even more resources for the people who attended today. It is 2 p.m. It is perfect timing. Thank you so much again for talking about such a difficult and sad topic. But it is useful to hear that there are not only programs but also leaders like you that are doing this work in a very thoughtful, trauma-informed way. So thank you so much for attending and enjoy the rest of your day.
Thank you.
Thank you. You also.
Thank you.
Thank you for having us.
Thank you.